Welcome everybody to this first seminar or webinar this afternoon entitled Creating a Lasting Legacy Through Evaluation. My name's Liz Orton and I'm the Chief Investigator for First Light. So I'm just going to do a very short introduction and then we'll get going with the speakers. Okay, so today's session is focusing on looking at how we have a lasting legacy of our evaluations from first into practice, into public health practice. And we're going to think about how we have that impact in terms of practice, policy, and also people development. I think we've muted everybody's microphones and cameras just to keep the flow of the session, but if for some reason that hasn't happened, please do keep yourself on mute unless you're speaking. At the end of the session, we'll have an opportunity for question and answers, but if during the session you have any questions that you'd like to ask, please do pop them in the chat and we've got somebody monitoring the chat. There we go. So first of all, I thought I'd just give you a very short introduction to First Light, who we are organising this session today. As I said, my name's Liz Orton, I'm the Chief Investigator for First Light, and we're a collaboration of 3 universities, the University of Lincoln, Loughborough and Nottingham, where I'm based. Staff are based at all 3 of those universities in the team. Really quick reminder, just in case, because we've got a lot of new people on the call today, so I just wanted to do a very quick reminder of what FIRST is. So FIRST is a National Institute of Health and Care research funded programme that aims to provide capacity to undertake evaluations in public health programmes, interventions and policies across the UK. And the programme was initiated to address the problem that often we work in public health practice but don't necessarily have the evidence of what works, and so we develop new programmes and then they need to be evaluated. Or indeed we have programmes that are in place but also need to be evaluated to see if we can improve practice further. And so the First Light programme offers that evaluation expertise to deliver evaluations in a robust and timely manner. There are 8 FIRST teams across the UK, of which First Light, organising today, is one of them. And as you can see on the map, the evaluations that have been completed so far are throughout the UK. The First Light team, based in the 3 universities at Nottingham, Loughborough and Lincoln, just like the other First Light teams, aims to do pragmatic academic evaluations of work that's already happening in local government. And this is to increase the evidence of what we have available to us regarding public health practice. We've had a very wide range of topics to evaluate so far. Today's speakers are not from First Light, so it will give you a flavour of the types of things that we do. So we have already recruited the research team. We've been up and running for a couple of years, and we have experts from a wide range of areas. We have a separate independent oversight group that scrutinises the work that we do, and the funding is for a 5-year period for each of the programmes. You will know if you work in local authorities that the NIHR has called a couple of times a year asking you to provide expressions of interest of services or interventions or programmes that you would like to be evaluated, and these are prioritised, and then those that are selected are allocated to the FIRST teams to undertake the evaluation. And then we have an oversight group who is independently chaired to provide us with critical advice about our evaluations. So who are we? Well, this is our team at First Light. On the left of the slide, you can see the team based at Nottingham. Again, a wide range of researchers, research fellows, research assistants and public advisor. And then top right, we have the Lincoln team. And then bottom right, we have the team based at Loughborough. But we work right across the 3 universities in a matrix style. So far, the projects that we've been evaluating, again, are based across the UK. So we have a project evaluating programmes to improve the well-being of people working in the nighttime economy in Bristol. We've got a project in London and Greater Manchester looking at training for councillors for elected members and the impact that that can have on wider determinants of health and mental health. A project evaluating a falls prevention programme in the Hampshire area, and an evaluation of a school streets project in Newcastle. So all projects are pretty varied across the evaluations that we're given. Public input into our evaluations is really important, is at the centre of what we do. We have, in First Light, we have a co-applicant who was on the original bid, who's part of our team. We have public advisors on our oversight group. We have a public advisory group, some of whom today are with us today to talk about their experiences in the programme. And then for each project, we set up a local public advisory group to support that particular evaluation. So the public advice is really threaded throughout the whole programme. So that's all I really wanted to say today by the way of an introduction. So I'm going to move on now to the main section of the webinar, which is two presentations from different evaluations, where we'll be looking at the impact that the evaluation has had. So our first evaluation, I'll stop sharing now. So our first evaluation is the impact of a co-inquiry collaboration with frontline staff, refining a stop smoking evaluation project, the change from face-to-face to telephone specialist advice in Bedford, and that presentation is by Thomas Mills from South Bank First and Ruth Dean, Health Improvement Lead from the County Council.
Thank you. Can you hear and see me okay? Is the slide shows up? Yeah, good. So good afternoon. My name's Tom. I'm a Senior Research Fellow based at First South Bank. And I'm here today with Ruth Dean, who was a Senior Manager of our local partner for a recently completed evaluation. We're going to talk today about the impact arising from a co-inquiry work package. Just to set the scene a little bit, I'm going to talk about the broader evaluation to begin with. So the PI for this was Professor Lynn Dawkins, and the local government team, as Elizabeth said, was spread across Bedford Borough, Central Bedfordshire and Milton Keynes, BMK stop smoking services that was shared services across these local governments. And the main evaluation question was, we'll explore the effectiveness and acceptability of the shift that the service had done during COVID towards telephone support and compared that with face-to-face delivery. And this was achieved by, let's say, various quite traditional evaluation approaches across 3 work packages: so statistical analysis of routine data, surveys and qualitative interviews with both staff and service users to really explore that shift to telephone support during COVID. Also a cost effectiveness analysis that compared the 2 forms of service delivery. But my work package was slightly different. This was a co-inquiry work package. And the context for this co-inquiry work package was coming out of that post-COVID period. The service was seeking to really raise awareness of the service offer, to reach out to communities, to speak to members of the public, and to say again that the service is still there and the offer that it has. And actually, from the research team's perspective, we noticed quite a lack of evidence here in terms of actually how to do community outreach in the context of smoking cessation service. So reflecting on that, we developed a research question: how can a smoking cessation service enhance engagement with underserved communities? And I developed a kind of co-inquiry approach. And in developing this, I really wanted to involve frontline staff, but do so in a way that wasn't demanding of their time and would fit and adapt to their busy work schedules as they did their community outreach, but also, of course, their core work in providing advice and support. So we held 6 co-inquiry sessions over the course of a year, and 13 frontline staff were involved in those. In those co-inquiry sessions, we reflected on the outreach, how it was going, how it might be refined. We also reflected on data collected through the process. Some of that data was collected by staff themselves through reflective diaries. 32 observations of outreach events were recorded. I also did observations of 8 outreach events. And also interviewed 8 community members of the communities being targeted. And this was all about collecting some good, rich qualitative data to really consider, test, evaluate staff's working assumptions about how the community outreach was working. And I should say, I also interviewed 10 members of staff. But we're really lucky today because we've got Ruth here as a representative of the local partner. I'm just going to end the show so we can come onto the screen. But Ruth, do you want to start by giving yourself introducing yourself?
Yes, thank you, Tom. So as Tom's mentioned, my name's Ruth Dean. I have fairly recently moved roles, but at the time of the evaluation, I was the strategic lead for the Stop Smoking and Tobacco Control Service for BMK. And it's been fantastic to be able to follow that through to completion, even now that I have moved on to a different local authority.
Thanks, Ruth. And can I ask how you personally found the co-inquiry component of this evaluation?
Yes, of course. I mean, as you've already alluded to, the co-inquiry component coincided with the Stop Smoking Service returning to community outreach work post the pandemic. So it was extremely timely for us. Some of the team had joined the service during the pandemic and they'd never done outreach work before, and none of the team had done outreach for at least the last couple of years due to those restrictions. Contextually, as you mentioned, the service had shifted to a much more remote model of delivery over the pandemic, with that face-to-face support shifting to telephone. And as a result, we were really conscious when we decided to resume outreach work that there were communities that had not been able to engage with us properly due to those lockdown restrictions. So our initial temptation was to get out as much as possible to try and recover some of that lost time. And I think that's probably fair to say that's more reflective of our previous style of outreach, which tended to be more reactive, perhaps slightly more scattergun. Because we were doing more face-to-face work in the community, we were out and about more, we tended to say yes when invited to do outreach as far as possible, not necessarily always thinking about where the best time would be spent. So the co-inquiry work helped us to embed, I think, a more reflective model of practice into our outreach work, which allowed us to scrutinise the impact each time we attended an event. It helped us to evaluate where our time was best being spent and where it was ineffective or poorly targeted. And it also gave staff a way to formally record how an event had gone, which was positive both in helping us to celebrate where they'd had really good successes, but also to flag where outreach had been unsuccessful and a poor use of their time. So I'd say in summary, it was a really positive and evolving process throughout the duration of the evaluation and at a really key transitional time for the service.
Thanks, Ruth. That's really nice to hear. So what impact would you say did the co-inquiry have on the local service?
I think it was quite significant in terms of our outreach. So as personally speaking, as the service manager at the time, it helped me to evolve my perception on where I wanted that component of the service to be and where I felt we should be prioritising our time. We worked much more reflectively, as I've said before, than we otherwise would have done. And it changed the way fundamentally that we prioritised, delivered and recorded our outreach work. We developed a community outreach spreadsheet, which was themed around our strategic objectives. So when requests came in, if it didn't meet any of those strategic themes, we could say no, legitimately, it wasn't a good use of our time. We could also record how well it had gone, so we could review, we went to that last time, it wasn't worth going to, and we had that nicely documented and a real support for our decision making. We said we could see from our reflective logs which events worked and didn't, and therefore it helped us to build a really good network of trusted organisations to work with, where we knew events would be well organised and well targeted. We also used the learning to create a new project specifically based around community outreach within our higher deprivation areas. And from that, reflective practice and co-inquiry was built into the project design from the outset, because we had that new learning about how effective it was as a way for us to work. I think it also helped us to see that community outreach did offer staff opportunities to get out there, demonstrate their new skills, and particularly with the more remote models of service delivery, they weren't getting that opportunity to do that otherwise. It did also highlight that outreach is a particular skill set that is different from clinic work, and that some people are more comfortable and more adept at doing that than others. So overall, it was a very positive experience for us as a service, and it definitely supported us into that more reflective, strategic way of delivering outreach.
I think you've touched on this when you talked about the broader staff network involved in this. I'm just wondering whether you could elaborate on that. What impact did the co-inquiry have on the staff who participated?
Yes, of course. So I think the co-inquiry element was definitely it felt like the most accessible way to bring the whole staff team into the evaluation. The majority of the Stop Smoking team work on the front line of the service as Stop Smoking advisors, and they have, I think, fairly limited opportunity to be involved in wider strategic work or exposure to some of the decision-making process within the service. I had presented on the evaluation before at team meetings, but I think it lacked meaning out of context, whereas the co-inquiry work meant that the team's experiences, thoughts, and opinions were being directly sought and acted upon. And I think this was really beneficial in helping them to feel valued, and also in understanding some of the broader work taking place to shape and improve the service. Additionally, I think it's fair to say there was some anxiety from some people in the team about returning to outreach work post-COVID. And I think it helped this process to demonstrate that we are doing this in a mindful way, that we're scrutinising the impact and benefit of it. People's time is being thought about and used wisely. So I think it was really helpful to have that collaborative element within the team.
I'm also interested in, because this was co-inquiry, very different to the other work packages. I'm also interested in hearing how it really compared or related to those other work packages going on.
So I think the co-inquiry work was something that we could elicit a much quicker benefit from. With the more traditional evaluation work packages, there was a more rigid process that needed to be followed before we could start to understand what the findings were and begin to implement change. It's worth saying that the evaluation from start to finish was about 2 years. Whereas with the co-inquiry work, we were able to see from the reflective logs and discussions that were taking place more immediately what we could do to improve the way that we were delivering our outreach work. And it sounds really simple, but I think asking staff to take a conscious step back and evaluate each time they did outreach work helped us to break that more reactive cycle we had been in previously. And it shared some of that responsibility across the team, rather than that always just sitting in a top-heavy way with management. I think it was also one of the only opportunities in the evaluation for us to directly hear from members of the public who are outside of the service. Some of the other work packages sought opinions from people who'd used the service before, whereas this is people who, for some reason, were not accessing us, even though they may be smokers. So it helped us in part to understand some of those barriers to people accessing our support in a fairly immediate way.
Absolutely. Thank you, Ruth. I thought I would just share a research output with everybody, because that's what it was all about, wasn't it? It was about reaching out after those COVID restrictions have been lifted, putting a face on the service. So that was something that staff used to really summarize what they were doing out there. And during those co-inquiry, we were reflecting on this and developing a model. So I don't have the time to go through all of this, but I thought I'd just kind of highlighted it as one of the research outputs of this. So at the top there, you have the kind of external challenges. And staff are very aware of some of these, of some of the kind of the fallout of broader cultural wars and a sense of public health being the fun police. Also in Stop Smoking specifically, some of the quite confused messaging on e-cigarettes and recreational normalization, but actually these kind of barriers or challenges, if you like, were being very kind of like navigated and negated sometimes by staff's outreach. They're out there chatting to members of the public, as you say, Ruth, who are disconnected and sometimes disconnected from health services altogether, building up those relationships and trust. This is the activities in the model, that section. Also doing a lot of awareness raising and fact checking around e-cigarettes, careful discussion around the local services offer of e-cigarettes, which was new and created a lot of interest, but needed quite careful discussion to ensure that it's not promoted as a recreational device. This is a support to help people and support people to quit smoking. And this was part of it because it was both staff wanted it to come across, and it came across in terms of, certainly among the people that I interviewed in my observations, as a very positive offer. Staff are very keen to not be non-judgmental they're making people aware of the support available, and we were able to identify impacts of this activity, both learning impacts in terms of knowledge of the service offer, feelings of trust in the service. One of my interviewees said that there is hope. They hadn't been aware of the service offer, but now they were. And also doing so, actually agreeing an appointment there, and sometimes actually having it taken up there. This leading to a reduced drop-off rate that had been kind of identified as something that was that the staff had wanted to kind of improve, and it really did work. And some of my interviewees were people, as I said, who were disconnected from health services. They didn't know that this offer was there. They only became aware of it because there had been an event locally. There had been a stall that staff had attended. They'd gone and they'd heard about it and they got the referral there. But as you say, Ruth, there were some events that were sometimes not attended very well by the public, that had diminished reach, and what staff were doing, it was kind of like dependent on the quality of the community events organised by external partners, and that realisation was kind of very real through that co-inquiry sessions, wasn't it? That actually needed to take a more kind of strategic approach, because some of the feedback that I was getting was that it's quite frustrating for frontline staff who've gone to an event. They're fiddling their thumbs because it's quite poorly organised, hasn't got the reach, and they've got a million other things to do as part of their core role. But it was fascinating to see how you were adapting to that, and part of that the co-inquiry was kind of feeding into that. But that's just a brief overview of this model. But if you're interested in that, please do have a look at some of our research outputs from this evaluation. So just to conclude, really, we think that co-inquiry is a relatively undemanding way to engage frontline staff in research with various benefits. The impact, as Ruth says, it seems to have a more immediate impact and change to service delivery here, really refining the community outreach strategy, prioritising it in terms of really targeting people and communities that are most in need of that knowledge and the support provided. But also thinking through what is the most effective use of staff time in meeting that need. Also, frontline staff are involved in a systematic research process and directly involved in that, and in a way that we think really complements actually traditional forms of evaluation. As Ruth says, this was the one work package that the service really got to speak to members of the public who are not engaging with the service. So there was a real benefit there in terms of involving the public. But also for me as an external evaluator, I'm forming relationships with staff. I'm getting to understand what the service is about and what staff do. And then that was really invaluable as well in terms of when we went to kind of complete the other work packages. It provided me with context to really understand what was going on. But of course, this is supposed to be research as well, and I think that model is really testament to some of the research findings that we have from this. And I think it's really interesting context in smoking cessation services, where you have that concentration of smoking in underserved, hard to reach communities, areas where there's higher levels of deprivation. And arguably what we might see over the next 5-10 years is really these more proactive ways of going out into communities and facilitating routes in. The importance of this kind of work and might actually become more important as we go forward. So I think some good research gains there. So I'm going to stop sharing there. Yeah.
Thanks, Tom. Is that the end of your duo?
That's the end. Yeah.
That's great. Well, really interesting. I have a question, but I'm just going to give anybody else an opportunity to ask a question first. I see any hands going up. So we've got a question. Is this a question in the chat? Is there scope for PPI? If so, where are the opportunities? Oh, I think is that a question that's more generally in the first programmes? Is there scope for PPI? I can't tell who's asked that question. I'm sorry. Or was it specifically for this evaluation? If you either want to clarify the question in the chat or come online, that's fine. I'll ask my question if that's okay, and it's to Ruth. So I think, Ruth, you mentioned that this had really changed how you go about sort of appraising the value of what you're doing and making sure that what you're doing is adding value. How will you as a team, and I know you said you've changed job, but how will you as a team carry on making sure that you have that reflective practice? And also, are you intending to spread this out to any other service areas in the council?
I think what we learned, it was really important for us to embed it as business as usual, rather than it being something that we just do across one area of our work, that actually reflecting on the work that we're doing, its effectiveness, asking staff their views. And again, it probably sounds really straightforward, but when you're busy and you're trying to run a frontline service, you tend to just stick to what you know, and actually changing the way that we think about the work that we do and reflecting on it more mindfully, I think had a benefit across all of the service. I think we are not always very good at spreading that across other teams, but I think that's a really valid point, that actually this is something that we could certainly be sharing with other parts of the organisation to say, look, this has really worked for us. And sometimes it's as simple as just recording the impact of each event that you've gone to and marking whether it was worth doing again, because otherwise they come up again, these invitations crop up again. You're keen to show that you're out in the community and you never really think about whether it's a good use of your very valuable staff time. So I think that's a good challenge actually to make sure that's shared much further.
And did your staff, having been involved very much in the research directly, have they reflected since on kind of their perspective of, you know, was research what they thought it was going to be?
Yeah, I think probably the staff as a whole were fairly disengaged from the evaluation otherwise. So I think once Tom came to our team meetings, he came to one of our away days, he interviewed staff, he attended events with them one-to-one. It really helped them on a more personal level to understand what we were doing, to understand that research model, to be involved in the wider work. I don't think without that, you can present as much as you like at meetings about the general evaluation, but it didn't mean anything out of context. So I think having that more personal and having somebody outside of the service doing that really helped actually to further that understanding for the team. I think if I'd have done it myself, I don't think it'd have had the same impact as Tom coming in externally.
Thanks, Ruth.
Can I just comment on those?
Sorry, go on.
Could I just comment on those? I just think they're really interesting questions. On the first one, you've got me thinking actually, because in 2 weeks' time, I'm doing a presentation on this to teams from across the local government, and yeah, I think I might try and pitch it slightly different as something that actually it's a model that teams more widely might explore and implementing. I think that's really helpful, and try and think through how we could kind of like spread the way of working. And on the other point, yeah, we are. I've been quite immersed in data, but we're kind of like now thinking about impact and talking to staff about how they found the process. So we will be going to the frontline staff, but we haven't yet to really to explore questions like you mentioned in terms of like how they found it and whether they thought research would be like that.
Yeah, good. Thank you. We've got a couple of minutes before the next presentation. So I think, did I see a hand go up? I can't see your hand now. It might have gone up and come back down again.
A couple of things in the chat. I don't know if you want me to address those directly.
Yeah.
There's one around the CO verified quit. So have we compared the effectiveness of face-to-face versus telephone support for routine data collection? That is picked up in some of the other work packages. That there were some slight confounding factors around data which are explored in the evaluation, in that we had a much longer period of telephone support evaluated than we had face-to-face due to some of our data recording timeframes. And it was quite interesting in terms of the different groups and the difference in outcomes between face-to-face and telephone. It wasn't always what we'd expected. So I would recommend, I think Tom's put a link there to the full evaluation. I'm happy to discuss further. If you want to take my details out of this, it's not a problem. And in terms of recording the reflections and learnings, Tom developed a reflective document which kind of he co-produced with the staff to capture specific reflections from the events. And we then developed that into a wider spreadsheet where we themed it, color coded it, and had different categories about number of attendees and number of referrals taken, etc. So we could really look at that when those requests came to attend that event again. So that was really helpful.
That's great. Thank you, Tom. Oh, you're on mute, Tom.
Do you want me to pick up the question about the PPIE as used in this work package?
Okay, sure.
So we did just very briefly, as like First Light, we try and embed PPIE through everything that we do, both at the centre level, but also at the context of the particular evaluation. So we did have a PPIE panel here who are recruited from the local service, and they're ex-smokers who've been through the smokers, and they were able to advise us on things like topic guides and what have you, but also quite high level in terms of actually the research focus. But for this work package in particular, we didn't have any PPIE from people who are smoking and not engaging, and that was the group that we really wanted to crack. And I was looking to and hoping that I might be able to recruit as I went about interviewing people and doing the observations out there, but I wasn't able to actually recruit someone formally to the PPIE panel, but I still was able to get that perspective through the interviews and through conversations at the observations event. But I think that's a real challenge to really kind of broaden out the PPIE sometimes.
Yeah, thanks, Tom. Thanks for clarifying that question. So thank you both. That was a really interesting presentation, and great to see the legacy that the evaluations had as well. So now I'm going to move on to the second of our two presentations from evaluations, and that's an evaluation of Southwark Council's Summer 22 Holiday Activities and Food Programme with Leandro and Anita. I'll hand over to you, Leandro.
Thank you, Elizabeth. I will just share my screen, and then Anita will start with the presentation. 1 second.
Hello everyone, my name's Anita. I work for Southwark Council as a Holiday Provision Programme Officer. So I support in distributing the funding and support providers in delivering the Holiday Activity, Food and Fun Programme. And I'm here to present our stakeholder network analysis, which was one of our research outputs for evaluating the programme overall. Going to move over to the next slide. So just an outline of what we're going to discuss today in terms of, I'll give you some background regarding the Holiday Activity, Food and Fun Programme, the need for why we did a stakeholder network analysis to begin with, and then Leandro will continue giving you the steps and tools that he used for the main outputs, and then it'll come back to me to give you lessons and reflective practices as me working for Southwark Council, but also being an embedded researcher for the first team. Thank you. So the Southwark Council Holiday Activity Food and Fun Programme. We may be aware that families are heightened and stressed due to the cost of living, especially during the holiday period. So the reaction from the Department for Education was to fund a holiday activity food and fun programme, and this is provided during the longer periods of the holidays, so the Easter, the summer, and the winter school holidays. So we were not funding providers during the small half-term periods. The focus of the programme is to reach children aged between 4 to 16 years old, so that's reception right through secondary school, who are in receipt of benefit-related free school meals. Southwark Council, they received from Department for Education 1.5 million, and that's to cover all three within the academic year of the holiday periods. We fund places for children at holiday clubs, and they could be anything from schools, youth groups, church organisations and children's centres. And we designated funds across the whole of Southwark, especially within areas of high deprivation. So you may hear of it as Food and Fun Programme, Holiday Activity Food and Fun Programme, but Southwark, it's known as the HAF Programme. Next slide. So the aims and objectives of the HAF programme is that young people get to eat more healthily over the school holidays. So the Mayor of London Kitchen Social would produce take and make boxes. If you're not aware of what they're like the Hello Fresh, but then the children would be able to go home with their parents and make meals. So we used to offer that. And during the programme, children are offered things like sandwiches, just food, or hot food as well, especially during the winter programs. We encourage our providers to engage in physical activity. So I was very fortunate to be part of the QA visits, our quality assurance visits, where I got to see young people doing sports, from tennis, from football, from netball. And if it was a provider that didn't have outdoor space, they were making use of their local parks and so forth outside to engage in physical activity. Not only did it focus on food as well as physical activity, but one of the objectives of the programme is that they engage in enriching activities that support their development in terms of resilience, in terms of character and their well-being. And one of the examples I could give is going to see an organisation where they're practicing mindfulness with the children or with the teenagers. Also to be safe and socially not isolated. And so with some of the research outputs where we got to do interviews, so one of the questions would be, if you weren't here, what would you be doing? Most of the young people were reporting that they'll just be at home not doing anything or engaging in things that they shouldn't be engaging with. Having greater knowledge of health and nutrition, where our providers would not only do cooking classes, but also give that understanding of what healthy looks like, as well as being culturally appropriate in their delivery of their sessions, and to be more engaged with school and local services. So trying to provide a wraparound support. So in terms of the programme, for this to happen, the two questions that the first team were looking at was, what can local insights actually tell us about the impact and the implementation of the programme? And what opportunities can we do to improve the programme? So how best to look at local insights than to ask the service users themselves? So we had an array of different research methods that we used, from parent surveys to parent interviews, young people interviews. We also looked at attendance data, and our focus, what we're doing today, is the stakeholder network analysis. So why did we want to do a stakeholder analysis? We wanted to look at the impact on the food network overall and where the HAF programme sits within that, and how our providers actually interact with our local food offer and the network. And from that, we could we could see areas of maybe that we need to improve on, or any gaps within that food network. So for example, could it be that there's training and development that's needed for our providers? Could it be that we need to, are our resources up to date in where different food networks are? For example, food pantries, social supermarkets, because we also wanted to create that wraparound support. So not that just parents will actually send their children to a holiday program, but we were providing a wraparound support. Another element of the stakeholder survey was to try and build a recommended supplier list. So our providers are providing food. Was there somewhere within the food network where, okay, this works best for this provider, maybe another provider who's struggling with a recommended supplier, we can actually start recommending suppliers to use and build up a list. So I will pass you on to Leandro, who will focus a lot more on the stakeholder analysis. Thank you.
Thank you, Anita. Hello, everyone. So I'm Leandro Garcia. I'm a lecturer at the Centre for Public Health at Queen's University Belfast, where I work with a range of methods related to systems thinking, complex systems, including network analysis. And in the next 2 or 3 slides, I will present the steps that we followed to conduct our stakeholder analysis and the outputs that we achieved, and explain a little bit also what a stakeholder network analysis actually means. So in the next slide, I have a representation of a network, right? So I have nodes, which are these circles, and we have edges represented by these arrows. And this could be a representation of any kind of network, right? So what we try to do in stakeholder network analysis is to use the methods and techniques used more widely in network analysis to investigate specifically networks of stakeholders. So in this case, each node would represent a specific stakeholder. And here we have different colors, perhaps representing different types of stakeholders, for instance. And each one of the arrows would then represent a type of relationship. And here we have dashed and full lines representing, for instance, 2 different types of relationships. And once we get a representation of the network after eliciting the relationships and the stakeholders, we can start asking questions like, how dense of relationships is the network? Are there isolated or poorly connected stakeholders? What are the hubs in this network? Perhaps that the identification of hubs might help us to identify certain actors that, for any reason, go out of the market. For instance, a supplier that goes out from the market could perhaps disturb a large amount of stakeholders and the network itself. What are the prevalent types of relationships? And this is, of course, a sample of the questions we can ask ourselves. And if we imagine that this is a snapshot of the network at a given moment, and we take multiple snapshots over time, you can also see this network evolving. And we can think, as Anita mentioned before, of interventions that can increase the resilience of our network, for instance, to all sorts of disturbance, or for instance, bring to the network actors that might be isolated or poorly connected, for instance. So this kind of analysis help us to create a diagnosis, to inform actions to improve the network structure, so how to become more resilient, for instance, and functional, right? So how we improve the structure itself so that the flow, for instance, of information or of any other materials or goods are optimized in the network. So what are the steps then to conduct a stakeholder network analysis? So many of these steps are actually very similar to any other type of survey that we would conduct. So in our case, first we define the research question the questions in the survey. And these questions, of course, are defined also by the research question more broadly, and they would be very similar to other types of surveys that we conduct. So we would have questions about the attributes of the stakeholders responding to the survey, so the type of organization, the remit, etc., their size, for instance. And questions about the relationship. So each stakeholder responding to the survey would nominate and many times qualify the relationship. And by qualifying, we mean say aspects like for each one of the relationships, like the type of relationship they have, the frequency of the relationship, etc. Once we have the survey prepared, then there's the survey period. And the survey period, perhaps different from what we see in other surveys where we interview, let's say, households. It might contain one or more waves of sampling. So usually we would not know the full extension of the network that might be common in many situations. So we'll start what we call a seed sample composed by the institutions or people that we know are part of the network. And as they start to nominate new stakeholders, then we would continue to interview these new waves of stakeholders to have a fuller picture of the network itself. Once the survey is finalized, then there is the data analysis and report. So as you see, the steps are more or less the same as we do with any other surveys. There are some specificities because we're trying to capture network data. And of course, in terms of data analysis, there are specific approaches to analyze network data. There are specific softwares as well that can be used. Many of them are free to access, free to use. And those who are more interested in those more technical details, I'm happy to share them afterwards. In our case, we use online tool to collect the data. And this tool is called stakeholder.net. It's a tool that we developed here at Queen's University Belfast as part of an agreement that we have with the WHO European Office, who request us to create a network, a tool like that to collect data from partner countries across Europe. It is a free-to-use tool. So if you're interested, I left here the link, and the slides will be shared or have been shared already. So you're welcome to try and use it. There will be very soon now in May training opportunities on how to use this specific tool. And again, if you're interested, contact me, and I'm happy to share the details of this tool on these training courses as well. Here I have a screenshot of what the questionnaire will look like for the participants. So on our left, we have questions that are very common, seeing other types of surveys. So what holiday club do you work for? What's your name? And here in question number 3 is where this respondent starts to nominate their suppliers in this case. And here there is already a predefined list of suppliers that can be extended as respondents add suppliers that were not initially identified by us. And that extended list of suppliers then is going to be available for the next respondents. And here on question number 4, just an example of other kinds of questions we can ask, in this case, specifically about what kind of food opportunities or food are offered to the children and families attending that holiday club. So it's a mixture of questions about the relationships and questions that we normally see in surveys ask about the institutions themselves. So here I have 2 examples of outputs. Maybe it's not great to see. So here we have the geographic boundary of the Southwark Council, right, represented here. Each one of these nodes are either a half provider, a food supplier, or a service that the half programs signpost families to go for different services. And here, each one of these dots are geographically represented within the council. And you can see, for instance, in this case, which providers or which suppliers, sorry, each one of the half programs are using. Perhaps if they are using suppliers are far away from them, and why they're searching for food suppliers farther than the other options they could have close to them. We also can see, for instance, where perhaps programs might be less, the density of programs will be less than in other areas, or suppliers, for instance, etc. This is another way of visualizing the same kind of outputs, but in this case, each one of these dots represent either a half program or a supplier or another sign services that the half programs signpost to. And here, there is no geographic data defining where the circles are positioned. It's much more in terms of helping to visualize the network itself. And here, the bigger the node, the more connected that node is with other elements in the network. So again, we can see here, for instance, that some perhaps food suppliers provide food to many more half programs than others. And perhaps, if there is a disturbance or something happens with that food supplier, we can see the possible knockoff effects on the network. So that's all I had to show right now. I will call Anita to speak about the lessons and uses and reflections. Over to you, Anita.
Yeah. Next slide. So in terms of reflections, so I think it was important for me to be an embedded researcher on the grounds at Southwark and also be liaising with the first team. So we would have weekly meetings and I'll be able to pass on any information to the team, especially with our providers in actually getting the survey completed. So one of the things that I noticed was the timings. With every research, you have deadlines, and I noticed that I'll give an example. When we had to distribute the survey, we distributed the survey on reflection at a bad time that wasn't convenient for the providers. And so we changed the way that we did that. And with research, you adapt as well. And so we changed that for the next holiday period in terms of making it part of our monitoring and evaluation, rather than the beginning of the programme. And we saw the difference in terms of responses. So where I had asked providers, please fill in this questionnaire, this survey, there was a low response because providers were focusing on actually getting the programme delivered and sorted, and coordinating and getting all their activities in order. But then there was a massive push when we did it again at the end of the holiday period as part of the monitoring and evaluation that we asked them for. So that was a good learning point and something that we will continue going forward when we need to retrieve information from our providers. Also, as embedded researcher, the development of the relationship I had as a programme officer with the actual providers, I think strengthened, especially relaying to them the importance of data. When we're working in a field of data and we understand the importance of data, it's not often those on the ground do understand that. So I had times where I was able to liaise with providers and and explain to them, why are we asking for such information? Why are we having parent interviews? Why are we asking for the stakeholder analysis? And being able to connect the dots for the wider council objectives, especially under Southwark's sustainable food strategy. And I think being part of being on the ground at Southwark, as well as an embedded researcher, helped me strengthen that relationship with our providers and give them more depth and understanding to why are we asking for these things. As mentioned with the monitoring and evaluation, I gave an example of the timings into when we actually plan interviews, when we actually coordinate these surveys, and the deadlines that we want them to be received by. All of the things that we've done with our research outputs, not just the stakeholder analysis, has now been put into an implementation plan for delivery to actually improve the HAF programme. And so that's really good. And I'm now able to add timelines, strengthen our relationships with other food providers, and also build a recommended supplier for our providers, which actually gives them a lot more time to plan the programme itself rather than the other external things which they do struggle with. Capacity building, it was very, in our team, we are a small team that actually coordinates with the Holiday Activity Food and Fun programme. So me coming in post was a lot easier for them to deal with the business as usual, BAU side of things with the HAF programme, and then me working with the first team to ensure that the research outputs are done. And yes, challenges, as mentioned, because of capacity, juggling the two, I would say that it was interesting for me personally as an embedded researcher, because I felt like I was doing my dissertation all over again after how many years. So that was a really good thing. And I think it's something that we will be doing in the future, of using people, maybe residents, to become embedded researchers in programs as well, such as this. So yeah, I think that's me. Are there any questions?
Thanks both. That was again another really nice kind of presentation explaining, you know, how these evaluations are really kind of making a difference in practice. Again, I'll go first if that's okay. So I just wondered, Anita, if you could say a little bit more about how you were received in the local authority in terms of being embedded researcher. How does that kind of, or how does the embedded researcher model kind of fit with the local authority? Did you have to do a lot of work to make that accepted?
No, I think with the team that I'm in, research is their focus. Evaluations, we commission programs, so midpoint reviews. One of the recommendations that actually came from the evaluation was having a centralized booking system, and that was something we were already working on. So it was really interesting for local authority to see that some of the recommendations are things that the team are already working on. So this just gave us even more rationale and evidence as that we were working towards our main objectives. And that also it fits in with the wider council strategies as well, in terms of tackling inequalities, who we are reaching, the accessibility of reach, and making sure that we reach the right target groups as well.
Yeah, so that alignment with the strategic goals of the organisation is important.
Yes.
Yeah, any other questions there for Leandro or Anita? No, not seen anything pop up. So, oh, Tom.
Yeah, I'll ask a question. Anita, it strikes me there's some similarities here in terms of the impact with your embedded researcher approach, in terms of like working closely with providers, staff, and generating reflective practice, and Yeah, use of data and things like that, and it seems to be similarities there. I guess my question is for Leandro. How did because the social network analysis was really interesting. How did that analysis generate impact?
Thank you, Thomas. To be honest, I guess that's a better question for Anita, as she is the person bringing the results, connecting directly with the people locally. Anita, do you feel to be in position to answer that question probably better than me?
Yeah,
Definitely.
Thomas, can you ask the question again?
I'm wondering how the social network analysis that helped generate impact.
I think with the social networking that we had, it was the communication with the providers was really important, and in terms of the timing, but it was, I think, I would say we had meetings. So we had meetings with our providers to actually explain about the future evaluation that we were going to do, so ahead of time. And I think that actually influenced the impact in them actually getting the work done, because it was, for providers, it was extra work for them. They would then have to find parents to actually fill in the survey, because we don't have the parents' details. So they would then have to find the young people that we would have to interview. So getting them to understand the reason we were asking for this information and joining those links to, like I mentioned, the wider council objectives, and also pinpointing how it would be impactful for them as a provider. So if I give an example, the foods. So a lot of the providers had a problem in terms of their recommended suppliers. From our quality assurance visits as part of our business as usual, that had been fed back that they've had problems with food providers. And by doing something like this, we were able to actually navigate, this is a good provider, this is what people are using, this is the feedback that we've been getting. And then, as you can see with Leandro's analysis, the bigger the nodes, that's how more providers were beginning to use that recommended supplier, so be it, or signpost to this particular food bank. And as I mentioned earlier, it was also the wraparound support, which was one of our objectives. If I speak from the parent point of view, where in the evaluation as a whole, not many of them knew that the HAF program was somewhere where they could actually access wider support. And so if you go back to the network analysis and you look at how people are signposting, you also saw the differences with the amount of people that were not signposting, which then went back to the parents actually relaying back they didn't even know that they could be signposted. So that's where the impact, where we were able to match the dots. So you found one element and then another element came in, if that makes sense.
I'm gonna have to draw that to a close.
Yeah.
We have got another question, but we're a bit over time now. So because I want to give enough time for the PAG discussion in a minute, if people do want to have a quick convenience break, by all means do go. But Marcia, did you want to ask your question anyway, and we'll perhaps have a brief answer to that? You're on mute.
Yeah, just a brief. Both our presentations were really interesting. This one and the smoking one. The thing I wanted to ask Anita and Garcia, I think Anita, what does success look like for you at this stage? I'm listening to when you say about the hubs, and you talk about the forums, and the fact is that you can get questions out there, which is really good. But what I thought about when we talked about the wraparound service, I thought that's wonderful. But for you as a researcher, at the stage that you're in now, what does success look like?
DFE continue their funding because it ends this year. That's what success looks like for us. But looking at
without the funding,
without the funding, so this evaluation has actually helped, and it's a piece of work that I'm working on now. If DFE do not continue the funding, what does HAF look like? what do we want HAF to look like? And that's what the evaluation has done, because we've had local insights and we've also got our strategic goals to meet. So that's what the evaluation has helped us to do, to prioritise. Yeah.
That's great, thanks. And I can see Chris has got your hand up. Again,
Yes.
we're going to go straight into the next session after this. So go ahead, Chris.
This was just a question from the chat, Liz. So the question in the chat to the team was, I wonder what have been the main hurdles of the stakeholder analysis and what the team would have done differently if they had to do it all again?
So we did do it again. Yeah, we actually did do it again. What I mentioned earlier was we got a low response the first time round that we did it. And after discussions with the providers, it was the timing. We had distributed it just before they started the holiday program. And anyone who knows when you're organizing something, that's the last, you're not even checking your emails. So the next time round that we did it, we incorporated it as part of the data collection that we do as business as usual. And then the response increased.
Can I very quickly two things. One of them is that one thing that we also noticed in the first round is that some of the providers were reluctant to share what they see as strategic information. So once they visualize the potential for the uses of the outputs from the analysis, that also facilitated the engagement in the second wave. So that's another thing. And a third thing is, network analysis can be very technical as well. And there are lots of metrics that can be used, etc. So the other thing we need to be very careful is how to transform whatever comes out from the technical work in something that is in a language that's useful for those using that information at the end. So instead of having pages of technical numbers, etc., something that is perhaps simpler, but more people can engage, and do and act using that information.
Okay, thank you. Thank you to both sets of speakers for your presentations, and we look forward to looking at those evaluations in more detail. I guess if they're not published already, they will be soon, and we'll be able to see that. So I'm now going to move on to the last bit of the session. When we were thinking about impact from our evaluations, we were conscious that some of the impact we hope to achieve is through our public participation in the research. So maybe that's impact directly on the public participants, maybe it's an indirect impact on the lasting legacy of the evaluation through to the public. So we thought it would be quite interesting to invite 3 of our members of our public advisory group from First Light to have a conversation about their experiences of impact. So we're all conscious that the public involvement in research standards were launched in 2019, and we wanted to focus on 3 of those standards in this particular conversation. So thinking about the governance, how public involvement is managed as part of research, thinking about impact on the members of the PPI members, but also the public more generally, and then thinking about how we make sure that our public engagement is inclusive of all of our communities. So that's where our questions are going to, or our conversation is going to be focused. So first of all, can I ask our 3 public advisors to introduce themselves? So Beauty, Marcia and Pradeep. I'll go with Marcia just because you're top right at the moment on my screen.
Sorry. Hello, I'm Marcia. Lovely to meet you all. This has been a really interesting thing to be involved in first, and thank you very much for involving me in this. My background, I'm a registered nurse, registered midwife, now retired from that. I've been in regulations for the last 10 years, and now I'm looking at the community. I'm very involved in the community, and some of the community that I actually am involved with knew me when I was a little child. So they see me in a light that I'm there to serve them, basically, and be there as they're my elders. And so that really impacts a lot of what I do as a community and engaging with them. So that's a bit about me.
Thanks, Marcia. And then Pradeep, you're down at my bottom right.
Thank you. Good afternoon, everyone. My name is Pradeep. Yes, I've joined the PAG group and bring in my lived experience and I suppose in terms of what's called a portfolio career. So I've 20 plus years as a carer for various members of my family, dealing with my own health issues. So it's dealing with health and social care in that respect. And then with the portfolio career, it's public appointments at national, regional, and local level in the areas of housing, law and regulation, and health.
Thank you. And Beauty?
Good afternoon, everyone. My name is Beauty Chuma. I'm based in the Northeast. I work for a local mental health trust, Tees Eskenwe Valley NHS Trust. My role is minority ethnic lead and link, as it were. I work with communities, new and emerging communities that have settled in the Northeast. My background is social work. I have worked in the community for a long time. So I've been part of the First Light group for a few years now, and I'm involved in the Newcastle Schools project. Thank you.
Thanks, Beauty. Okay, so I'm going to come to Pradeep first, if that's okay. So I wondered if you could talk to us a little bit about the First Light Public Advisory Group, how it works, and how the advisors feed into the various different projects.
Certainly. Well, the PAG group as such, there is a very diverse group itself from experience and from the protected characteristics. There's 10 of us at the moment. I think there could be 11. And 2 of our members, the public applicant and 1 other, sit, if you like, on the management stroke board side. And we therefore have a bilateral, if you like, relationship with the management that feeds back information to us and us to the management. The rest of us, as such, we undertake the various programs that come through that require evaluation, and it's up to us. It's whether we're interested in a particular project or not, and we therefore, volunteer to do that. For myself, I've undertaken 2 projects that are going through the process at the moment. The first one deals with at East Sussex deals with the prevention of homelessness itself, and mental and health well-being, and trying to create a holistic approach rather than just signposting. So what I'm doing is liaising as such between the main PAG group ourselves and with the East Sussex one. So I'm actually part of the East Sussex PAG group itself. And we've gone through it from the beginning onwards, from selecting and recruiting the PAG group at East Sussex to the various questions we need to go through, the various review of documents, to actually make sure that people can actually evaluate once we get to that stage. And then, it'd be about dissemination and a review process. So that is still ongoing. We're at the point where we're nearly, I think, completing the actual questionnaires, and so the evaluation process will start. One of the great benefits of the group itself was recruiting people who had experience of homelessness, which was very difficult to do, and around issues of reimbursing people for their time and how that should look like, because there was issues about whether we should be contributing or reimbursing people and maybe affecting their lifestyles if they're homeless. That was one of the issues. The second group project rather is called Thrive, and that's to deal with the prevention of mental health and retraining local counsellors regarding their mental health as a hook to really see how that training can implement into the strategies and policies of the people that they represent and the local authorities that represent. So what's the ongoing impact? So it started off in London itself. That's completing, and we've started in Greater Manchester at the moment, and we've done the training to, I think, 3 groups of various local councillors, and recruiting from them onto the project itself, so we can actually view over the long period what is their involvement in terms of the strategy and input as councillors in the area. So they're the 2 projects at the moment that I'm taking part on. And as I said, that if we're taking a local project, we're involved in that, but we take that back to the main PAG group and have a review session and where we are, etc., and have that fed back to the management itself. And then we also want from the management what the other projects are, what's happening there, just to keep up to date. As I mentioned before, one of the things that we are reimbursed for our time, and I think there's set criteria in terms of how much work you're doing for that.
Yeah. And you said that you choose whether or not an evaluation is of interest to you. How has that worked out in terms of, has there been a good spread of projects for different people to be involved with according to interests?
Oh yes, I think that's the icing on the cake, if you like. You see something you like and you go, I'm interested in that, and it's open, obviously. And for those people, I think we've had 2 recent members who are kind of very keen on saying, well, what projects are coming on board and we want to get involved in. So I think at the moment it's not a question of that there's a project that any other PAG group is not willing to undertake.
Yeah, that's great. Thank you. Thanks for your insight on that one. I'm going to move into ask a question of Marcia now. Marcia, I know you're really passionate about making sure that public health evaluations reflect different communities. I just wondered if you wanted to say a little bit more about that.
Yeah, thank you. I did not know that I was passionate about the community. I really didn't know. I just knew that I was involved in healthcare and those sorts of things. And when people kept hearing that I was retiring and they heard that I was standing back, the community came forward, and I started to learn so many things that I didn't realize. And I really want to share that when you talk about the part of the NIHI, when we look at not governance, but inclusiveness, how do we become inclusive with our community when our community in some ways are just trying to find out who they are? And our community is evolving in so many ways, and yet we are looking at inclusiveness. So we are ourselves, as we look at inclusiveness, there's such a story that we don't even know yet. So many things that we don't know about being inclusive. So that in my little world that I was in, I started to find out different things. Like, for instance, one lady that I knew as a child, when one day a community engagement person came to me and she said, Marcia, so-and-so was walking on the street in her slippers and her nightdress, and we had to bring her to the emergency room. This lady didn't know me before, but she was a community engagement person. She came to tell me that this person from the Caribbean community was doing this. And what I realized was this person lived maybe 50, 60 years on this street. And so as you age, your home becomes an extension of your community, of the street that she's on. So walking out of her front door in her nightdress and her pajama and her slippers was just a thing that was just normal for her, because as she aged and her mind and her brain health was being affected, her mind took her out further into the street. It wasn't something that she meant to do. It was just something that happened, and she didn't see it abnormal. But what happened is eventually she was put into a nursing home. And when she went into the nursing home, she was put into a nursing home with people and behaviors and mannerisms that she didn't know. It was a people that she wasn't used to, because she was brought up in a community. That's all she knew. That was that she chose to be in. And now she found herself. And I remember when going to see her in this nursing home, and she said, because she knew me as a little child, she said, Marcia, how can I stay in here? I don't know these people. They don't know me. How can I live in here? I don't think I can do it. That was one example. Then I started to find other things. People in the community, in the Caribbean community, started to become older and get admitted to hospital. And as they got admitted to healthcare, or they had to see their GP, certain things happened. And as they aged, certain things happened. They would go into speaking patois, which is one of our lingos. It's broken English. Because remember, the Caribbean is from the British Empire, so it was always acceptable. But as they got older, people didn't understand what they were saying, so they started to give them labels of being confused or having dementia, when really what they were doing was speaking. But people that were treating them didn't understand what they were saying and didn't realize that it wasn't dementia and it wasn't confusion. And also they joke, the Caribbean population, we joke a lot, we've got a sense of humor. So there's things that they were saying, it was just normal for them, but they started to get these labels attached to them. And basically what I started to understand is that when we speak about inclusion, it's not such an easy term as that we can just throw out there, because there's so many dimensions to it. We talk about one person, he was in hospital, and we knew that he never wanted to die in hospital. And he wanted to go home. When he came in the 50s, he bought a house, and he'd always lived in this house. He'd brought up his children in that house, and he was in hospital. And I remember going to see him, and he had his socks on, and he said to me, he stood up from the hospital bed, and he looked out the window, and he said, "Mars, how did I get from here?" And he looked at his socks to here, and he was on the top building of this hospital. And I knew what he was saying to me is, "Mars, I need my shoes because I need to get out of here." And because he knew he needed to be home to die. I linked him up with the Macmillan service, which was incredible, with his daughter. I linked him up with his daughter, and his daughter contacted the Macmillan service, and they spoke to the consultants in the hospital. And in a day or so, everything started to roll. The healthcare set in, everyone set in, and within a day and a half, he was home. They got the hospital bed in his front room. He was able to have the windows and look at his road that he lived on. And I saw him relax. I saw that smile. I saw him just relax. And you could see it in his eye. You could just see him relax. And so what I'm talking about is this first project. What it is, it looks at so many things. And what we're doing is we're involving the community. And this is how we're going to be able to address research more, because once we involve and we use, for instance, our hubs and our forums to, and just get the word in, just get information and use participation. I think that's going to be something quite interesting.
Yeah. So making sure, so the researchers shouldn't assume things. They shouldn't assume that they understand or know. That we really need to draw on that expertise from our public contributors who have the connections back to their communities.
And remembering as well that the public contributors are learning as well. We're learning we're learning our community. There's things that we didn't know. Yes.
And then you get more and more expertise in that.
Expertise, yes.
Yeah.
Yes.
I've
grown in a couple of years. This is a new life for me.
That's amazing. Thank you. Thanks, Mark. Okay, and just for time, I'm going to move on now to Beauty. Last question for you.
Okay.
So I know that you do a lot of work with refugee groups and their communities. I wondered if you've got some advice about how you would encourage people from those communities to take part in research.
Okay, thank you for that question. As I said earlier, I work with refugees, and these we term new and emerging communities. I'm sure you are aware that we've had 4 different resettlement schemes in the UK recently: the Afghan, the Syrian, and the Ukraine resettlement. These communities are coming into services that were developed without them in mind. When I'm working with these communities, my role is to educate and orient to life in the UK. I share with communities why it's important for their voice to be heard, why they must get involved in sharing their lived experience. This is explaining that this is a potential legacy for the future generations. Many of them won't be going back to their home countries, or they'll be here for a long time. So it is important for their voices to be heard. I come from the African community, and we are fairly new communities, probably 30, 40 years in. So the way we absorb information and take part in any project is from understanding from the people like us. We ask someone, can you tell me, you went to this service, what is the mental health service? How did they treat you? So that is important when working with different communities to understand their points of reference. Where do they come from? Empowering people includes explaining and making things simple to understand. As professionals, it's easy to use the language we use every day. We need to break things down and explain how they look, what they mean in the ground. For example, research. What is research? You need to break down that research, what it means and how it is implemented. I explain to family communities that the research, if you are part of that, it will take years. Probably when your grandchildren are born, whatever you do today, it will impact on their lives. So it is important to explain what is data, what are they collecting, what is it for, how is it used? And as researchers, I'm sure, and people working in public health, we're aware of the data gaps and data bias that exist. For instance, traditionally men were used and in a lot of studies, and with the medicines we use today that are used by women and men. So the gaps that exist are from these communities. We are moving already to the concept of personalized medicine, looking at tailoring treatment to suit people's needs. So it is important for these communities to be part. We all understand and aware of how they were, the pandemic, these communities were hit hard. So to address those inequalities, we need to really drill down and talk to people and get their lived experience, understand the intersecting needs and barriers to accessing. For example, why have they been labeled hard to reach? My view will be to twist that on its head and say they've been ignored or they've been marginalized. Because I tell the communities, why are you hard to reach? Because that's what people believe you are. And they say, we've been always here, Beauty. We are not hard to reach. So as professionals, and if we are really interested in looking at inequalities, we need to be creative, innovative in our approach. As can I stop and then ask another question? Because I could go on for the whole day.
and it's really fascinating listening to you and all of you. And I think what you're saying is that, we as researchers really rely on our public advisory group to provide that, both the trust with their communities, to provide the insight, to provide the connection and the interpretation, and sort of spanning different boundaries, I suppose. To make sure that our research is relevant to everybody, and we really appreciate that. So I'm going to end with a final short answer. I'll do a kind of end of the night wrap up or end of the day wrap up. So if you could just give me one little snippet, each of you, and I'll start with Pradeep. What would you like to the legacy of the First Light Public Advisory Group to be?
I think it's a much greater recognition of the public involvement and getting that rolled across all sections of our society, whatever it is, in whichever areas, so that feeds into what Beauty was saying, that we get more encouragement from the public to actually take part. And so what I want is better sustainable transformation in healthcare outcomes in health and social work.
Thank you. And Marcia? What would you like the legacy of the Public Advisory Group to be? Oh, sorry, Marcia, you're on mute.
I'm just thinking that not outlining governance and anything else, but I think inclusion needs to be rethought, because we have put a lot now over the last few years in inclusion. Now we need to take it to the next level of what inclusion really does mean.
Thank you. And Beauty?
I could say the same for both, because we always use these big words, and what do they mean in practical terms? Tackling inequalities, what does it mean? Is it the same as equality and equity are two different things? So it's for us to take the legacy will be for public health providers, researchers, to really unpick the language that they are using to suit the communities, so that when they come back and want to engage further, they've laid the groundwork. We need to change the way we work so that it is, as Pradeep said before, it is normalized behavior for any community to say, I am feeding into this, research, or I'm part of the PPI involvement because it's everyday language. So that's it for me.
That's amazing. Thank you all so much for that conversation and for supporting the webinar today. And thank you to everybody who's attended. It's been excellent attendance. We had well over 100 people dialing in today. I think for me, it's shown just what ripple effect evaluations can have, both in terms of the immediate evaluation results, but then the knock-on impact that these evaluations have on communities, on the public health teams, and how they continue their work in other areas. We're leaving behind tools for people to use, and I've seen in the chat some conversations about, well, can we share that? Can we have a copy of that? That's really important as well, as one of the outputs for these webinars. And to really get the public and everybody more exposed to research, so that there's more people willing to take part in research, and the importance of our public advisory groups and public participation in research to do that. So some really fascinating learning today. Thank you all for attending. There'll be another webinar in the not too distant future, so please do keep an eye out for the date of when that appears. And thank you once again for attending.